Welcome back, everyone. We are really excited to show you our next video and share our panelists with you. So we have Kathy and we have Tracy in our nursing and midwifery education areas, and they have lots and lots of experience and will be able to answer questions that you may have in that career space. We've just posted the video, so if you want to click on that, you can watch that, and then we'll come back to our panelists. Thanks.
At the moment I'm on the medical ward. I'll come to work, clock in, I'll go to handover, which is in the morning at 7 o'clock. We will collect our sheets that have all our patients' names and their conditions and stuff like that to keep an eye out. We'll go through some aggression risks with certain patients so we know where to be cautious.
I'll go to handover at 7, get all the information that we need for the day, making sure everyone was all right during the night, no met calls and all that sort of thing. I'll go hand out all serviettes throughout the ward and get ready for breakfast and just helping with people needing to go to the toilet or all that sort of morning thing.
I guess I was completing year 12 and you have those meetings with your career counsellors and we were weighing up my options, and obviously going to uni was an option after year 12, but then everything with coronavirus and stuff like that kind of turned it upside down. Yeah, so it kind of made me realise that I might want to take a little bit of a break from full-time study and just work and save so that then I can have the best opportunity when I move away. Ever since I was little, I've always wanted to be a midwife. It's just always been a passion of mine. I'm just extremely interested in the way that babies develop and grow and what happens with the mother. And when I was in year 10, I actually did work experience here and I was fortunate enough to be placed in the NICU. So I would eventually like to specialise in premature babies and births and stuff like that. That would be my end goal. I saw this job advertisement in the newspaper actually. Went ahead and followed the application process online and was lucky enough to get an interview and then lucky enough to be successful. So as we're working, we're able to study and work full-time at Golden Valley Health in the health assistance role.
I was at ASH, Academy of Sport, Health and Education, and Leonie, our manager, actually sat us down and said, there's a job going at GV Health, and she knew that I wanted to do nursing. I have a son and he's 2, so I dropped out of school in year 10 and then I came back last year and finished my year 12. So my process is obviously a lot different to everyone else's, but yeah, I had a lot of people helping me and supporting, especially my grandma. So she had her kids quite young and now she's the MP of Geelong. And it made me go, well, I can still, do something. So yeah, that's why I did this, and it goes straight into the work as well as studying and everything.
I graduated from La Trobe Shepparton, and I'm in theatre for the first couple of months of my grad year, hopefully moving on to surgical and then specialist consulting suites.
I graduated from La Trobe University and I'm currently in special care nursery and then move on to rehab and medical ward.
I'm currently in haemodialysis, and then I will be going to surgical ward, hopefully, and then going to the special care nursery.
I'm one of the graduate nurses for 2020, and I first got allocated to the subacute ward.
Originally I wanted to do pharmacology, but yeah, I kind of wanted to do something a bit more hands-on, and nursing you do a lot with medications and it is hands-on as well, so you're doing things, you're building rapport with patients. It's sort of jack of all trades really in the medical field.
So I've always been passionate about helping others, and I believe nursing offers this unique opportunity, and being there for people at their most challenging days, and I think it's such a rewarding thing to be able to give back to them and advocate for them to achieve the best possible health outcomes, which is why it's motivated me to become a nurse.
So every day is a little bit different. One evening I had a fall, one patient ended up on the floor, and I had a couple of other things going on. And the amount of people that came into the room when I was under the pump was amazing. Everyone asked if I was okay and what they could do for me, not what I had to do. It was all about what I needed, so that was really great.
There's always learning opportunities for you to grow and expand on your nursing skills, and just the people you work with is absolutely amazing, from staff to educators. Everyone's there for you and they have your back as well, so it's a great program. It's a really good transitional program.
The first couple of weeks, you know, you're supernumerary in some of the areas, and yeah, you're very well supported with all your educators. There's not a time when you feel like you're lost.
So far I've loved just being in a really supportive team. Everyone's so nice, and like if you need something, like help with something, they're more than happy to help you. I just love coming to work.
I'm loving theatre completely. Started off in orthopedics, so you know, doing some joint replacements, which are great. You hear a lot in uni with some of the cases, but it's actually one thing to, you know, get in there, literally get your hands dirty.
I think the rotations, so I'm currently in special care nursery, like I said before, absolutely loving it. The staff there are absolutely amazing. It's a beautiful, positive attitude. I felt like I was a part of a team from day one. 100% recommend it. Definitely go for it, because GV Health has made it easy for me to transition as a student registered nurse into a graduate registered nurse, and like I said, it's an amazing supportive environment, so definitely go for it. And with the new development of the hospital, there's going to be plenty of learning opportunities as well.
I think the grad program is designed to really support you transitioning from that student to registered nurse phase.
The reason I applied to GV Health was because it was a rural hospital but large enough to grow, and there's a lot of different areas that are quite acute. I came from New South Wales, so it was a jump over the border for me, and I felt supported in the few legislation differences between New South Wales and Victoria.
Living in Shep is, one, desirable. It is close, but also doing placements here. I loved all the staff that I was working with on placement. I loved the different areas it has, and there's lots of things you can branch out. They support you doing grad programs too, doing postgrads in critical care. Another thing I'd like to do. I would love to continue here, and I am really enjoying it so far, so can't wait to see what the future brings for me.
So I am a local girl from Tatura, and I've had most of my placements here at Goulburn Valley Health and absolutely loved them. Had experience in all different wards, and I also like the idea of being able to move around and not just stay at one particular rotation, and the environment's really fun and supportive.
So again, like I'm from Shepparton and Latrobe, so local. It offers postgrad opportunities, which is what I want to do. So that sort of really helped me a lot to decide to come here. And I really like the values of GV Health. Like I think it just like embodies a nurse that I want to be. The values of Goulburn Valley Health are compassion, respect, excellence, accountability, teamwork, and ethical behaviour.
I think our grad program is really unique. Our grads get to rotate through various specialties, which is an opportunity that they wouldn't have in a big metro area. They're really nurtured and supported well.
So being on the floor working with all the graduates and students, seeing how supported they are, and wanting to just be in a place where I can help support that and give them more opportunity to learn from people with experience.
It's probably one of the most rewarding aspects to my role, to get to see the transition from being a novice practitioner to just to see how they develop and grow throughout their nursing career. So it's an honour to be a part of their journey.
Go ahead and just introduce myself as Kathy Scott. I'm the Director of Nursing and Midwifery Education at GV Health. And with me is Tracy Ebanakis, who's our Graduate Coordinator. and also our La Trobe liaison officer. So we're here to talk to you about any opportunities here at Golden Valley Health and answer any questions that you may have. So we currently employ 1,094 nurses and midwives into our workforce, and with our redevelopment that we've currently got, we're requiring a recruitment campaign and seeking to increase up to a couple of hundred extra nurses to provide care for the patients of our community. Tracy, did you want to introduce yourself?
So, hi, I'm Tracy. I'm the Graduate Nurse Coordinator. I also work at La Trobe as well, and liaise between GB Health and La Trobe. So with our graduate nurse program, we employ in excess of 50 graduate nurses. So you'll find that predominantly each Victorian hospital will run a graduate nurse program for their registered nurses. So what we offer here at Golden Valley Health is 3 rotations. So we have rotations through many of our departments. So you could be in our subacute ward, you could go to oncology, hemodialysis, special care nursery, medical, surgical, emergency, crit care. We have students that head out to our Tatura and our Warringah campuses as well, and district nursing. So we offer a variety of opportunities for our graduate nurses to experience a great deal of many areas. We also offer our graduate nurses some study days as well. So throughout the year, obviously, we know that you've completed your bachelor degree, but sometimes you need, some extra educational opportunities. So we provide those as well for everyone. It's a very supportive program. We find that it works very, very well, and we get some really great feedback and have quite a high retention rate from our graduate nurses as well, who actually want to stay at Golden Valley Health, which is fantastic. We also have opportunities, as Jordan mentioned in the video, for postgraduate study as well. So once you finish your bachelor degree and you're practicing for that year or two, you might find an area that you're really passionate about. So we offer, areas of postgraduate development in critical care. We have hemodialysis and renal, palliative care, midwifery as well. So lots and lots of different opportunities that we have for postgraduate studies too.
Good. So currently we have 23 educators here to support our workforce. So we certainly nurture and develop both our new staff and our ongoing staff and provide any learning opportunities that they seek. We have other educator providers who we also work with, predominantly 8, and we have several universities who we have about 700 student nurses come through our hospital and do clinical placements here, and that gives them opportunity to taste the waters and see if they like it here. And then that's also been part of our recruitment. They've come back because they've had such a positive experience. So are we answering questions? So I can tell you a little bit about me. I've had several different nursing and opportunities throughout my career, and we've worked in ED, intensive care, predominantly surgical high dependency was my passion. And there's all courses that we can do further studies in. So with the graduate program we have here with new staff coming on, we also have enrolled nurse program, transition to practice, that nurses coming from TAFE participate in, and that's quite well supported as well. And we rotate them through the acute areas and encourage them to participate in an advanced diploma through GoTAFE, and just to enhance some of their leadership skills and just enhance their clinical decision making. So with support of the registered nurse. We've got some questions here now from Mel. What characteristics do you need to be a nurse and midwife? My comments to that, and Tracy can follow, need to be a little bit versatile and pretty compassionate. Also, fairly resilient as well. So we are mindful of that, and that's certainly part of our support systems, that we ensure that staff have that throughout interview. But then when they're working here, we get a little bit tired or worn out, we encourage some support systems to help them. did you have any others about?
I was going to say sometimes you have the student that goes, oh, I don't like the sight of blood. You don't, to be quite honest, see a great deal of it. So don't stress too much if you can't stand the sight of blood. So that's always a good thing as well. Another question, how long do I need to study for? So there's a number of avenues that you can do to get into nursing. So to become an enrolled nurse, you need to complete 2 years at GoTAFE. So an enrolled nurse work predominantly under the delegation of a registered nurse. They have a little bit of different scope of practice to a registered nurse. So lots of our students who finish the TAFE course will actually transition to become registered nurses. So they'll finish their diploma and head straight into university. So they'll then complete 2 further years of study to become a registered nurse. There are benefits to this in the fact that as an enrolled nurse, you can actually work while you're still studying and you're still trying to consolidate your knowledge and your skills and stuff whilst you're still studying to become a registered nurse. The other way there's another way you can do it, so which is the way I did. I went straight from high school straight into university and completed my Bachelor of Nursing degree in 3 years. So, and I found this was very beneficial to me. At GB Health and a lot of other sometimes organisations as well, what we do is we actually offer a RUSON program. So this is our undergraduate students of nursing program. So what this entails is once you complete your first year of nursing at university, you can actually apply for a position at Golden Valley Health and act in this RUSON capability. So this includes you assisting with patients performing activities of daily living. You might be assisting mobilising your patients, you know, lots of talking to your patients and stuff like that as well. The good thing about this is that you're in the hospital environment quite early on in your career, so you can actually see how the hospital works, see what sort of nurses are around and stuff like that as well. It also helps with your time management. And then you'll again finish your degree at the end of 3 years. So, and then you're obviously registered nurse, eligible for our graduate nurse program as well. Lots of our RUSONs that we have actually go further and finish their degrees and stay on at Golden Valley Health and become graduate nurses too.
Very good. And also with our careers, both of us sitting here in the room, we've had opportunities in different areas, and nursing's actually really had lots of opportunities, and with our different activities throughout life, we've been able to change from full-time to part-time. We've been able to travel and work in different locations and then return home, which is good. You know, exciting opportunities that many of our graduates say, some of them, we have 85% retention rate. They keen to stay. Those that do travel away, they often go to Melbourne and then travel and then return, which is good. So in a 5-year, you know, we often see that those graduates returning home to Shepparton. So that's been exciting, you know, exciting for us because we've seen them grow and then come back. So what does a typical day look like for a midwife? So in the midwifery spectrum, there's antenatal care, which is before they have the baby, and then there's actually in the birth suite where the baby's delivered, and then the staff go back into the postnatal area where the patient goes. There's also the nursery or special care nursery, and we also have a midwifery group who see their mothers throughout their pregnancy. And for a typical day, one of the questions here look like in a midwife, you can see that because of the different areas, that is quite variable. But ultimately, it's caring for the mother and providing a holistic framework to the mother and babe. So we like some of the midwives that can see the mother go right through the pregnancy, see her at the antenatal visits, and then be with her in the birth suite. And that's through our midwifery MG program, and that's been quite successful. So a typical day, it's quite busy. If you think about the midwife today, she's up in the mid-ward looking after probably 2 to 3 patients, and then one of those patients may be booked in to go to a Caesar, and that midwife will follow her, go with her, and when the baby's born, bring the baby back to the special care nursery and then look after the mother in the ward, taking obs and making sure everything's healing. quite well, and then assisting with the baby feeds and mixing with the family just to ensure the mum's comfortable. Tracy, did you have anything to add?
Unfortunately, I'm not a midwife, so I actually don't know what happens up there a lot.
But they're quite busy.
They are very busy. There's another question. Can I do my nursing degree at TAFE and still do placement at GV Health? So as Kathy mentioned earlier, we do in excess of 700 nursing placements. Predominantly we have La Trobe University, Shepparton based, and these local students quite high priority. So at the moment we actually do have TAFE students on placement currently as well. So in saying that, to do placement, you actually need to do in excess of up to 800 hours of clinical placement. So not necessarily will you get all your placements at GV Health. I do know a number of students who have studied at TAFE or university have been to Wangaratta, been to Benalla, and throughout the region and the area as well.
So we have a clinical place. One of the next question was, do you accept people for placement? So just as Tracy was saying, we have many opportunities for clinical placement in all different areas for nursing and midwifery. We have a clinical placement coordinator who juggles the many requests that we have, and we make sure that the student, when they do come, they have quite a good experience rather than overloading and having too many students. We have probably about 4 to 6 in each of the clinical areas at certain times throughout the year. We have an educator supporting them. We also have clinical supervisors of the staff. They also support the student, who is usually buddied up with one of them. And how much does it cost to study nursing? So, well, Tracy's probably best to answer this because she's in with the La Trobe. With the Commonwealth supported places, how much is it actually now?
Actually, don't know. To get a Commonwealth supported place, I think it's 70% of your course fees are covered. So I would say that it was probably around the $10,000 mark. You'll get the benefit of going through, I suppose, university like that is you can actually get help. So where you defer the cost of defer your payments for your subjects, and then when you start working, you pay it slowly back as well.
Yeah. So that's optional for how you pay it. You can have prepayment and they discount a little bit as well. But yeah, Commonwealth supported places is really well subsidised at this stage, which is good to enhance our workforce. One of the questions Mel has put forward is school-based work placement. If a year 11 or 12 student completes placement with GV Health, will they also get the same opportunity as someone studying nursing? Well, actually, the year 11 to 12 student completing placement, we actually open up a few different areas for them when they are here. When the nurses students come from the universities, they're doing placements from what area they're actually studying as part of the curriculum. So that sort of not dictates, but basically makes the clinical placement requirement for that unit of study. So the year 11 students, we have about 7 areas they can rotate through, and we try to give them as much of an experience in different areas so they can have a little have review of different types of nursing and midwifery care. Can I take my nursing qual overseas with me to the UK, USA? Yep, certainly. So we have registration here with APRA, which is the Australian Health Professional Registration. And when some of our staff have headed off to the UK or the USA to travel to immigrate, they have just applied to the national registration body of that country, and we complete some forms and they have just proof of their registration. So yes, certainly you can, and a lot of nurses do travel and utilise the ability to work in different countries as a source of income. So yeah, definitely. Females or males preferred for nursing midwifery? Well, of course, there's no preference. We do have it is a female dominated profession. However, I would have to say all the males that I've worked with have been enjoyable part of the team and just bring a different perspective. But they are certainly reduced numbers, but I think in our last cohort of graduates, there was only 2 of the 50 graduates. But yeah, certainly we welcome both females and males into nursing and midwifery.
Again, we're seeing more and more males come through nursing, which is, you know, great as well. But yeah, definitely no preference.
So just with the versatility of nursing, I must say, like Tracy, she was working clinically as well in teaching also, and now has 2 jobs where she can complement both the transition of the student into the graduate program. And well, I was doing management, but also teaching into TAFE and teaching into universities, working clinical. So there was just the versatility of our jobs has been quite rewarding too. We can seek out new challenges. We tend to recreate ourselves every 3 to 5 years and do something different, although we bring the skills that we've acquired along the way. So is there a good work-life balance to nursing? That's what we certainly try, and we enhance some, discipline techniques with our staff because we're doing a bit of shift work, and that's we're encouraging that work-life balance, and we certainly try to do good rosters to enhance good days off and not too much night duty, and so certainly it is challenging to keep the life balance, but we certainly achievable. And how long is the midwifery course? Currently there's options to do the midwifery course. We facilitate a postgraduate course for staff that have already graduated, and that takes them a year. You can enrol to do a 2-year grad dip, but some of our staff finish after just 12 months with a graduate certificate. We also have the undergraduate opportunity for midwives who can just do midwifery study, but we encourage the postgrad, we encourage the double degree in that stance and to do both registered nursing and midwifery as well. Currently we have a cohort of 6 midwife students who have done their RN registered nursing training and then gone on to do the postgrad, and we run them every year in affiliation with Bendigo La Trobe University, and of which they have about 20 cohorted. Yeah, certainly encourage that. We have special care nursery courses as well for midwives or nurses to look after the neonatal or the young baby just born, and we facilitate that course through this as well in affiliation with La Trobe. So is there any more questions from Mel or Angela?
Thank you.
Yeah, thank you. All right, well, thank you for having us, and good luck with anything. And any inquiries, don't hesitate to make contact with us here, and certainly Alison can assist you to make contact with us.
Thanks, Kathy. Thanks, Tracy. You've done a great job, and you really paid attention to the chat box there. So well done for answering lots of questions, and I think we've got quite a bit of interest out there in nursing. So that's good to hear. Lots of people coming through, hopefully in years to come. Thank you, ladies. You're free to go, and we are going to finish up and let you all have a break. And if this is our sort of mid-morning break, and then we'll see you back at 11:30 for our next session.